This pain reliever PM extra strength tablet contains two medications, acetaminophen and an antihistamine. Acetaminophen helps to reduce fever and mild to moderate pain, such as headaches, backaches, and muscle strain. The antihistamine in this product may cause drowsiness, so it can be used as a nighttime sleep aid. It can also help relieve allergy or cold symptoms like watery eyes, itchy eyes/nose/throat, runny nose, and sneezing. Remember, this product should not be used in children younger than 6 years old. It's important to carefully follow the dosage directions to decrease the risk of serious side effects. And be sure not to give other cough and cold medications that contain similar ingredients. Always consult your doctor or pharmacist for more information on using this product safely. Before taking pain reliever PMX strength 25 mg to 500 mg tablet, make sure to carefully read all the directions on the product package. If you have any questions, it's best to consult with your pharmacist. If your doctor has prescribed this medication, be sure to take it exactly as directed. You can take this medication by mouth with or without food. If it upsets your stomach, taking it with food or milk may help. If you're using the liquid form, be sure to measure your prescribed dose using a medication measuring device or spoon, and not a household spoon. If you're taking extended release capsules, be sure to swallow them whole. Do not crush or chew them, as this can release all of the drug at once and increase the risk of side effects. The dosage of this medication is based on your medical condition and how you respond to treatment. It's important to take pain medications as soon as the first signs of pain occur, as they work best at that time. Avoid waiting until the symptoms have worsened, as the medication may not work as well. Adults should not take this product for pain for more than 10 days, and children should not take it for more than 5 days unless directed by a doctor. Similarly, for fever, do not take this product for more than 3 days unless directed by your doctor. If your condition lasts or gets worse, or if you suspect a serious medical problem, seek medical help right away. Some common side effects of pain reliever PMX strength 25 mg to 500 mg tablet include dizziness, drowsiness, constipation, stomach upset, blurred vision, or dry mouth/nose/throat. If any of these effects persist or worsen, inform your doctor or pharmacist promptly. It's important to note that if your doctor has prescribed this medication, they have determined that the benefits outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. However, it's crucial to contact your doctor immediately if you experience any serious side effects, such as mental/mood changes, like confusion, or trouble urinating. While a severe allergic reaction to this drug is rare, seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. Keep in mind that this is not a complete list of possible side effects. If you notice any other effects not listed above, it's important to contact your doctor or pharmacist. In the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Acetaminophen is an ingredient in this product that can cause serious liver disease if taken in large amounts. Adults should not take more than 4,000 mg, 4 grams, of acetaminophen a day. People with liver problems and children should take less acetaminophen. Be sure to ask your doctor or pharmacist for advice on how much acetaminophen is safe to take. Do not use this medication with any other drug containing acetaminophen without consulting your doctor or pharmacist first. Acetaminophen is found in many over-the-counter and prescription medications, so be sure to check the labels on all your medicines to see if they contain acetaminophen. If you're unsure, ask your pharmacist for help. If you take too much acetaminophen, seek medical help immediately, even if you feel fine. Symptoms of an overdose may include nausea, vomiting, loss of appetite, sweating, stomach pain, extreme tiredness, yellowing of the skin and eyes, and dark urine. Daily alcohol use, especially when combined with acetaminophen, may harm your liver, so it's best to avoid alcohol while taking this medication. Before taking pain reliever PMX strength 25 mg to 500 mg tablet, make sure to let your doctor or pharmacist know if you are allergic to acetaminophen or antihistamines or if you have any other allergies. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so it's important to talk to your pharmacist for more details. It's also important to inform your doctor or pharmacist about your medical history, especially if you have breathing problems, glaucoma, heart disease, high blood pressure, liver disease, stomach/intestinal problems, an overactive thyroid gland, or urination issues. This medication may make you feel dizzy or drowsy, so it's important to avoid alcohol or marijuana when taking it, as they can increase these feelings. It's best to avoid driving, using machinery, or doing anything that requires alertness or clear vision until you can do so safely. If you're using the liquid form of this medication, be aware that it may contain alcohol, sugar, and/or aspartame, so caution is advised if you have diabetes, alcohol dependence, liver disease, phenylketonuria, PKU, or any other condition that requires you to limit or avoid these substances in your diet. Be sure to ask your doctor or pharmacist about using this product safely. Additionally, before having surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. When it comes to children, they may be more sensitive to the side effects of antihistamines, and in young children, this drug may cause agitation and excitement instead of drowsiness. Older adults may also be more sensitive to the side effects of this drug, especially dizziness, drowsiness, confusion, constipation, or trouble urinating, which can increase the risk of falling. If you are pregnant, it's important to use this medication only when clearly needed, and it's best to discuss the risks and benefits with your doctor. This drug may also pass into breast milk and may have undesirable effects on a nursing infant, so it's important to consult your doctor before breastfeeding. It's important to be aware of any potential drug interactions that could affect how this medication works or increase your risk for serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's also important to let them know if you're taking any other products that may cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or other antihistamines. Additionally, antihistamines are found in many non-prescription products and some combination prescription medications, so be sure to check the labels on all your medicines to avoid taking too much of this ingredient. It's also important to discuss any potential interference with certain medical or lab tests with your healthcare providers. Remember to always consult with your doctor or pharmacist before starting, stopping, or changing the dosage of any medicines. If you or someone else has taken too much of this medication and is experiencing severe symptoms such as passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 for emergency assistance or contact your local poison control center at 1-800-222-1222. Canadian residents should reach out to their provincial poison control center. Signs of an overdose may include nausea, vomiting, loss of appetite, sweating, abdominal pain, extreme tiredness, agitation, confusion, flushing, hallucinations, yellowing of the skin or eyes, dark urine, seizures, and in children, initial excitement followed by loss of coordination, drowsiness, unconsciousness, or seizures. It's important to follow your doctor's instructions and not share this medication with others. Remember to keep all of your medical and lab appointments as scheduled. If you are taking this medication regularly and happen to miss a dose, take it as soon as you remember. However, if it's almost time for your next dose, it's better to just skip the missed one and continue with your regular schedule. It's important not to take a double dose to make up for the missed one. Remember to take your next dose at the usual time. Make sure to store pain reliever PMX strength 25 mg to 500 mg tablet at room temperature, away from light and moisture. Do not keep it in the bathroom and avoid freezing the liquid forms. Always keep medications out of reach of children and pets. When it comes to disposing of this product, do not flush it down the toilet or pour it into the drain unless directed to do so. Properly discard the medication when it is expired or no longer needed. It's best to consult your pharmacist or local waste disposal company for the correct disposal method. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.